internal features of the heart. Is a heart from inside. The structure of the heart is formed by starting by thick wall of cardiac muscles covered from outside by epicardium and lined from inside by endocardium. The fibrous skeleton of the heart is formed by framework of dense collagenous fibers which forming four fibrous rings surrounding the orifices of the valves and continuous with the membranous part of the ventricular septum to form a powerful fibrous link between aortic, pulmonary, mitral, and tricuspid orifices with the membranous part of the ventricular septum. This is the fibrous skeleton have four rings. This one ring for the aortic valve, another ring for pulmonary valve, and this is one ring here for mitral tricuspid with the membranous part of the interventricular septum. The function of the fibrous skeleton of the heart: number one, it gives attachment to the myocardial fibers. Number two, gives attachment to the cusps of the valves. Number three, prevents deformation of the heart. Number four and last point, acts as electrical insulator between atria and the ventricles, and the conductivity between atria and the ventricles occurs through the atrioventricular bundle only. The right atrium have the following features. Number one, crista terminalis, a vertical ridge on its lateral wall. It extends from the opening of the superior vena cava to the opening of the inferior vena cava. Crista terminalis divides the cavity of the right atrium into two parts. Smooth posterior part derived from the sinus venosus during development, and the rough anterior part derived from right atrium of the fetus. It is rough due to presence of pectinate muscle or musculi pectinate. It has an oval depression called the fossa ovalis, surrounded superiorly and anteriorly by an arched margin called limbus ovalis or annulus ovalis. Opening in the right atrium, this is the fossa ovalis here, and this is crista terminalis, pectinate muscle fibers. Opening in the right atrium, number one, superior vena cava opens opposite the right third sternocostal junction. Opening of the inferior vena cava opens opposite the right sixth sternocostal junction. Then coronary sinus opens at the left side of the inferior vena cava between the inferior vena cava and the right atrioventricular opening. Right atrioventricular opening or tricuspid valve, then opening of the anterior cardiac veins and the small openings for vena cordis minimi. There are two main parts inside the right ventricle. Smooth part inside the right ventricle, it is the part just below the pulmonary orifice, and the rough part, the rest of the cavity. And the roughness due to muscular ridges called trabeculae carnii and papillary muscles. These are muscular projections arising from the walls of the ventricle. They are attached by chorda tendini to the cusps of the tricuspid valve. They are arranged according to the walls of the ventricle. Number one, anterior papillary muscle attached to the anterior wall, inferior papillary muscles attached to the inferior wall, then septal papillary muscle attached to the interventricular septum. Then moderator band or septomarginal trabecula. It is a muscular band extending from the interventricular septum to the anterior wall of the right ventricle. It prevents overdistension of the right ventricle. And this is papillary muscles here. This is the moderator band. The opening of the right ventricle, number one, tricuspid valve or right atrioventricular orifice, admits the tips of three fingers. It is guarded by three cusps arranged as follows. Number one, anterior cusp, largest, related to the anterior wall of the ventricle. Number 2, inferior cusp related to the inferior wall of the ventricle. Number 3, septal cusp related to the interventricular septum. The ventricular surface adjacent to margin of the cusp gives attachment to the chorda tendini, which are fixed below to the papillary muscles. Opening of the right ventricle, pulmonary orifice guarded by a valve having 3 semilunar cusps, 2 cusps anterior and 1 posterior. Each cusp concave towards the pulmonary trunk and convex towards the ventricle. At the middle of the margin of the each cusp, there is thickening called nodule, while the margin is called lunule. This is nodule here, and this is lunule of each cusp. Left atrium's wall are smooth and receive the following: 4 pulmonary veins carrying oxygenated blood from both lungs, opening in the left ventricle through the left atrioventricular orifice, which is guarded by mitral valve or bicuspid valve. Its auricle projects forwards. It is rough from inside due to presence of musculi pectinate. Interior of the left ventricle, it has a smooth part and rough part. Smooth part lies just below the aortic orifice and called aortic vestibule. Rough part due to presence of trabeculae carnii. This is more numerous, and 2 papillary muscles, anterior papillary muscles attached to the anterior wall, inferior or posterior attached to the inferior wall. They are attached by chorda tendini to the cusps of the mitral valve. This is the cusps of the mitral valve. This is papillary muscles, anterior and posterior, and this is the chorda tendini fibers. Interventricular septum is composed of 2 parts. Membranous part forms a smaller upper part, and the muscular part forms larger lower parts. Openings in the left ventricle, left atrioventricular orifice or mitral valve. This is the mitral valve. Then it is found in the lower posterior part of the ventricle and admits the tip of 2 fingers only. It is guarded by 2 cusps of the mitral valve. Anterior cusp larger and lies in front and to the right. Posterior cusp smaller and lies behind and to the left. Openings in the left ventricle, aortic orifice again guarded by aortic valve, which formed of 3 semilunar cusps, 1 anterior cusp and 2 posterior cusps.